Hello, my name is Enos and welcome back to my channel. This is Work and Wonder, and today I am here with
Collins.
Yes, I have Collins with me here today again because today we'll be shooting a practical video. Today we'll be looking at the assessment stage of the mental health OSCE, and we'll be doing a practical form for depression with suicidal ideation. Most of you have been asking for the practical video for depression with suicidal ideation as well as for mania. But today we'll be tackling depression with suicidal ideation, and we'll be using the marking criteria as provided by the NMC, our own understanding of the marking criteria. That's what we are going to use to demonstrate to you how the assessment is done when it comes to depression with suicidal ideation. As you already know, we would have one of the sheets which is going to be the scenario. We are also going to have one of them which is going to be the student notes, which you put your notes on it, but it's not marked anyway. And then this is also going to come with another tool, which is the PHQ. Now you can see that all on your screen. And then we are also going to have an overview of the recent history. So basically I have 4 papers with me here, and that will be provided for you during your exam situation, and that is what you are going to use to do your assessment. So without wasting much time, as usual, I'm going to be
the video.
yeah, I'm just going to be the nurse, and then Collins here is going to be the patient. Without wasting much time, let's go straight into the video. So I'm going to start my station by reading my scenario. The scenario says that you are a mental health nurse working in the community, and you've been referred by the GP to go into Mr. Collins' house to do a mental health assessment. It says that please conduct a holistic mental health assessment using the recovery model of care, areas below, including self-care and adherence to prescribed medication. It says that a patient health care questionnaire has been provided, and then I will need to calculate and also refer the score and outcome to my patient. I need to discuss the outcome of the assessment and the PHQ-9 with my patient. Consider the current risk for patient using the information from the GP referral and information gathered in your assessment. Assuming it is 100 hours, 100 hours today, and this is 20 minutes station. So that is my scenario. I'm supposed to go into Collins's house to conduct this assessment. So I'm going to start. So knock knock, is the community nurse. Please, can I come in?
Yeah, you can come in.
All right, so I've entered into the scene. I've checked for scene safety. The scene is safe to approach. Please, can I close the door?
Yeah, you can close the door.
So I close the door for privacy. Can I please use your hand gel?
Sure, you can use a hand gel.
All right, so I put an ample of gel in my palm, palm to palm, palm to back, fingers interlace, fingers interlock, fingers interlock. Rotational rub of the thumb of the fingertips of the fingertips of the wrist of the wrist. My hands are clean and dry to approach. Hello.
Hello.
My name is Enos. I'm the community health nurse, and as referred by the GP, I am here to do an assessment for you. Is it a right time for me to do so?
It's all right. So
all right. Please, can I have my seat?
Yeah, sure.
Great. All right. Once again, good morning. How are you this morning?
Somewhat all right.
All right. As I said earlier, my name is Enos. I am the community health nurse, and as referred by the GP, I am here to do a mental health assessment for you. Is it the right time for us to do so?
This is a good time as any.
All right. Before we even continue, can you please tell me your name and your date of birth?
My name is Collins James. Date of birth is 12th of 03, 1990.
All right, Collins James, 12th of 03, 1990. Can you please tell me your GP's name?
My GP's name is Dr. Brown. Wellway Surgery, I think.
Yeah, Dr. Brown, Wellway Surgery. All right, Assessor, I can confirm that I am with the right patient. Collins, is it okay if I call you by Collins?
Yeah, it's all right.
Before we continue this assessment, would you want to make use of the washroom because it's going to take another 15 minutes for us to finish?
Not really, I don't think I'll need to.
All right, that's fine. In this case, Collins, do you know the reason why I am here?
Well, you said you're from the community, so I'm assuming you're here to see about my well-being or something.
Yes. All right. So, Collins, as I said earlier, I'm the community mental health nurse, and I've been referred here to do a mental health assessment for you because you reported to the GP with low mood, social isolation, and also attempted to self harm yourself by jumping off a cliff. Do you remember all these?
I remember.
So, Collins, would you want to share with me what has been happening lately?
Well, I've just been feeling very low in mood. I've been battling with depression for a while, and I don't know. And ever since then, I've just felt like isolating myself from everybody, including family, and I'm just sick of it. So I just felt like the best option is to end it. So that was why I decided to jump. But unfortunately, I missed this time around.
All right. I can understand your feeling, but Mr. Collins, is it? Can you pinpoint anything that triggered it?
Well, I can't really pinpoint anything that triggered it, although I think from the family aspect, there's been a lot of pressure on me, to achieve a lot, and I feel as if I can't meet up to expectations. Um, and that's added with the societal pressure. I just feel like I've had enough.
Okay. And is there anything that makes you feel better?
Well, I used to like to visit some friends, but some of my friends have moved overseas, and I don't know, then nothing practically.
Okay. In this your situation, Mr. Collins, is there do you think or do you feel your family has been supportive enough?
I think my family has tried the best they can, but I honestly don't see them changing my mind in certain things, but they can try their best.
Okay, I can understand that. Has this situation affected you anyway financially?
Well, financially, I have not been going to work as I would like. So I guess I'm not that financially stable. Although my parents are catering for most of my needs, so uh, that's just it.
All right, and I can see that you are well kept today. Has this your situation incapacitated you in any way in caring for yourself in terms of personal hygiene?
Yeah, sometimes I don't really feel like taking my bait. I'm not going
Yeah.
to lie to you. But I just knew you were coming today, so I decided to try as much as possible. Not to irritate you with my smell and all that.
Okay, how long has this been going on? When was the last time you had a bait aside today?
Couple of days ago, like a few days back, like 4 or 5 days.
4 or 5 days. Okay, I can understand that. Collins, I can also see that you are on some medications. Do you know the medications you are on?
I don't really know the medications I'm on. I got bored of them. I feel as if they're not as effective as I would have wanted. They're really not helping me with my mood, so I just decided to stop.
When was the last time you took these medications?
It's been over a month ago.
Okay, by the way, you are on fluoxetine 20 milligrams and then metformin 500 milligrams for your diabetes. So you took them 1 month ago,
Yeah, that was the last time.
and the reason for not taking them is
I don't
you
feel as if they
don't.
are working. I don't think I'm seeing the desired result I would like.
Yeah,
So I just decided to stop since they're not as effective.
yeah. Collins, I must say that with for mental health or psychotropic medications, what usually happens is that if you don't take these medications, you might not you might relapse back into your mental health problems, because I can see from here that you've ever had depression. That was 2005, and then since then you've been on medication. So most of the times, once you don't take these medications, you might relapse back into that particular mental health problem that you are in. So I would encourage you that you should try as much as possible to take these medications, and if the need be, you can always consult your um, psychiatrist for medication review. Is that okay?
Okay.
All right. Mr. Collins, I can also see that you have filled the PHQ9 when you went to the GP. Do you remember filling this form?
Yeah, I remember filling the PHK9. Yes, I do.
All right. So, Mr. Collins, what I'm going to do is that I'm going to quickly calculate it, and then at the end, I'll tell you what it means. Is that fine?
Oh, it's all right.
Okay. So, Collins, I have calculated your PHQ-9 and it gives a total of 22, which gives us a provisional diagnosis of major depression, which is severe. But then there are some components or some questions that you scored a 3 for that I want us to probe further. Is that fine with you?
Yeah, it's all right.
All right. So I can see here that you scored a 3 for sleep. I want to know, is it that you find it trouble sleeping, staying asleep, or you oversleep?
Well, basically, I mostly oversleep because I find it difficult coming out of bed and doing anything. So I just sleep mostly throughout the day.
Okay. I can also see that you score a 3 for poor appetite. Is it that you don't have the appetite to eat, or they don't provide you with the food you want to eat, or you don't just feel like eating at all?
I don't really have appetite to eat. So I don't eat as much as most people would like me to because I don't have the appetite. And also, they don't really cook the meals I want when I want them. So it's out of it.
All right. Collins, the last one I want us to look at is thoughts that you're better off be dead. Are you still having the thought of self-harming yourself?
Well, you see it as self-harm, but I see generally that I'm tired, I'm sick and tired of life, and I just want to end it all. And although I tried initially and it failed, but well, I know I definitely, I'm going to definitely try again. Definitely.
I can understand that, Collins. But Collins, do you have a plan and do you wish to share this plan with me?
Hmm. I don't really feel like sharing anything with you regards to the plan. But personally, I just know I'm sick and tired of life and I just want it to end. And I'm definitely going to do something about it.
Okay. Collins, from our discussion, I've been able to come to a point where I've realized that you have some risk factors that needs to be addressed. You have these risk factors of low mood, your social isolation, and then sleeplessness as well. And then even you're not even compliant with your medication, and you are also at risk of malnutrition because you have not been eating because of the reasons that you gave me. But Collins, with all these risk factors, if I involve your family, which you leave your mom and then your dad and then your brother who lives next door, do you think they'll be able to help you to keep yourself safe here in the community, and then continuity of treatments can continue here and we can address some of these risk factors that is worrying?
Well, I definitely know my family is going to try their best, but I don't think they can ultimately change how I feel inside. So I definitely know I'm sick and tired of living, and I'm definitely going to do something about it. That's all I know.
Okay. So, Collins, I can clearly see that with your risk factors of self-harm, low mood, sleeplessness, non-compliance, this is compounded with I can clearly see that you don't have the capacity to keep yourself safe in the community here, even with the involvement of your family. And therefore, I would want to suggest a very short admission into the hospital if you consent to it. And at the hospital, I'm very much concerned about these risk factors because if left unattended to, it is going to be very worrying, especially with that of self-harming yourself, which obviously nobody will want you to do. That's your family, ourselves, and then you yourself. So I want to suggest a short admission to the hospital. If you agree to this short admission, basically on the ward or on admission, what we are going to be doing is that we will be explaining all aspects of your care to you at the hospital. And then again, we'll be monitoring your vital signs, and then we'll escalate as per the news to policy. We'll also be assessing daily on every shift your mental health status, which include your thoughts, your feelings, your your behavior. But we will also be providing one-on-one support for you on the ward where you can ventilate your thoughts. You can talk to us on the ward about anything, absolutely anything at all. We are also going to refer you to the psychiatrist who is going to, since you are not really seeing the effect of your medication, he's going to review your medication with you and then let you know what the medications are supposed to do, and even how long it will take for it to kick in with regards to its effectiveness. We also have a ward psychologist who also talk therapies with you. Here, you don't really talk to people, so they are going to have talk therapies with you. Again, we the nurses will also try to engage you in ward activities that will keep you, busy. And on the ward, you can always approach any nursing staff anytime you are feeling down in mood or you have these thoughts of self-harm. And then everything we'll do, we will document it so that anybody at all who is coming to care for you on the ward will know exactly the plan and how we intend carrying it out. There are some problems here: sleep, your social isolation, and then your risk for malnutrition. All these areas will be addressed on the ward once you agree to this admission. Do you think this is something you want to go with?
Oh, I guess it doesn't hurt to try. I guess I'll try it and see how it goes.
All right, that's fine. In this case, what I'm going to do is that I will quickly get back to the GP and then let him know about the outcome of this assessment that I've done with you, and let him know that you have agreed for a short admission. And then we will arrange that and then quickly get back to you and then see which ward or which hospital that we will be admitting you to. Is that okay with you?
It's all right.
All right, that's fine. So in that case, I'll get back to the GP and then we'll make that arrangement. But in the meantime, if whilst I'm gone, if you are feeling low in mood, you are having these thoughts of harming yourself, what you can do is that you can call the GP at working hours. You can call 999 or 111 for emergency situations, and you'll be swiftly attended to. Is that okay?
It's all right.
All right, that's fine. Do you have any questions for me, Collins?
Not really, no.
All right, that's fine. So I'll get back to you and then I'll get back to the GP and then we'll get back to you as soon as possible.
Okay.
All right. So I'll take my leave and then I'll see you in the next couple of days. Is that fine?
Yeah.
All right. So, assessor, I'll end my assessment station here. All right, so this was a clear demonstration of how assessment is done in the depression phase. You could see that our patient here was going through depression with suicidal ideation, and there was the need for me to suggest an admission because he has thought of self-harming himself. He even has a plan and he wasn't even willing to share with me. In this case, I would have to admit him to the ward because if left on the community for treatment to continue, it's likely that he is going to self-harm himself. I tried involving his family, but he says that with or without his family, whatever plans he has in his head, he was still going to carry it out. So in this case, there was a need for me to suggest an admission for this kind of problem. So this is a brief demonstration of how the depression plus the suicidal ideation phase of the mental health assessment is usually done in the mental health scheme. This is our understanding of the mental health or the assessment marking criteria. There might be some things that some people also want to add, or there might be some things that some people also want to, subtract. But so far as you follow your marking criteria, then you are good to go.
Definitely. As long as you stick to the marking criteria, you're definitely good to go. And also, it is always good to know when to admit a patient. For example, from this scenario, you could see that the patient was not willing to allow for the help of the family, and he was definitely going to hurt himself if left unchecked. So, in situations like this, you must admit the patient. Okay, that's all.
Yes. So basically, and if you are following very well, you know that it's all about capacity, knowing whether the patient has capacity or not to keep himself safe in the community, and then also exploring the patient's risk factors. These risk factors will subsequently lead you to problems, and this will help you very well in your in the next stage or in the next station, which is the planning stage. I hope you have learned something out of this video. The next time we'll come your way with another assessment video for mania, which is also the the other aspect of assessment. So it's either you're having depression or it is what? Mania. So we are now done with the depression. Our next video will be demonstrating to you how assessment of mania is done. Until we see you in our next
Again.
video, it's a bye for now.